GP Care Group is the federation of 36 practices within Tower Hamlets who have all joined up together in order to be able to provide general practice at scale and to support the development of general practice. We are delighted with the PMCF, which is the Prime Minister's Challenge Fund hubs, which are going to be open, or are open at the weekends, 8 till 8, and delivering care also between 6:30 and 8. Currently, these services are running mostly with just general practice being offered, but we are really looking forward to the opportunities for nurses and HCAs to be involved in this as well, so that actually it can provide the full range of general practice and community care, particularly for working population who are currently finding it quite difficult to be able to access that in practices. This is an opportunity for them to be able to come at the weekends, book an appointment in advance, and for the staff involved in that actually to see working in a slightly different way, so the opportunity to work in different hubs, so in different practices, and actually to see a kind of slightly different population perhaps than what they would normally be able to see in their kind of working hours within the practice. So we would really like people to get involved and engaged in this in terms of expanding the services that we're able to offer.
Last year, from April, the CCG took on core commissioning responsibilities, which means for the first time since the CCG existed, we got to have much more say in the way primary care services are organised, delivered and paid for. This was seen as a really great opportunity because it gives us the chance to really influence the way in which primary care is delivered for our patients. And we've started a couple of big projects since the team came into being and we took over core commissioning responsibilities. So one of that is around the future of primary care and what is it that we want primary care to look like in Tower Hamlets. This includes kind of reviewing all the services, building on the really good and innovative work that Tower Hamlets has done with regards to the networks and the GP Care Group, but thinking about building a really sustainable future. Obviously, one of the really crucial parts of that is understanding our workforce requirements, and it's come through kind of loud and clear that we really need to build on multidisciplinary team working. So particularly the importance that pharmacists, HCA and nurses have in really providing that holistic care to patients. The second piece of work that we're doing is trying to support practices here and now. The practices that we've worked with so far have shown us really interesting their different skill mix in their workforce, and once again it's come through really clear that the role of nursing in a practice team is really crucial, and the practices that are really strong tend to have a really strong nursing team to support them, and that's something we're really keen to build on, and looking at how we attract more nurses to Tower Hamlets and also develop the nurses that we do have here.
Today's a fantastic opportunity to get nurses and HCAs together because we've realised that we need to communicate better with nurses, get them more engaged, help inform them and keep them supported throughout all the changes that are happening. So I hope people take the opportunity to let us know what we can do for them and give us some idea about how we can improve our communication and really get engaged with what's going on today. And for the changes in the future, we're going through a lot of change at the moment. Nurses are part of the multidisciplinary team, and we need to make sure that nurses and HCAs all feel that they are making a contribution.
Okay, so we've got all the challenges that anybody could possibly experience on these two sheets of flip chart paper, so that's fantastic. And what we're going to do now is we're going to make those challenges into 5 challenges, so we're going to lump them together and we're going to put one on each flip.
Today I came in here, before I came here I didn't know anything about the hub program. Today I understand more. I think I'm going to join the hubs and it's an interesting day. I gained more things. I had more knowledge about the GP group and all sorts of groups.
I just feel like I have a very nice day, very informative, and before I didn't know so much about Hub, but now I think it's know a lot about that. I think it's good for me to introduce this to my patient, and it's good benefit for myself as well.
I think we're going to take away all of the ideas and the solutions that you have all developed today, and work on those to produce a document which we can actually look to take forward and to develop implementation plans around some of those ideas and solutions. So that's really great, and thank you to everyone for participating so much this afternoon. So that's what we're going to take away and, as part of our commitment. What we'd like you to do now is to go away and take away some of the things that you've talked about today and some of the things that you've learnt from today, and start sharing them with colleagues and other people in the practices, because obviously the people who come today are only a small percentage of the population, and we really need everyone to be involved.
So it's been a really good afternoon. I think in lots of ways people have got engaged. We've got lots of things to think about in terms of how we get nurses, HCAs and others involved in the delivery of primary care 7 days a week. And I've got a big job to do in writing up all the feedback, so I'd like to thank everybody who took part.